Yes, hi, I'm Dr. Atencio here at Texas Spine and Sports Therapy in Austin, Texas. I have Brittany laying here. She's getting what's called a pulse wave done. When you're doing a pulse wave, it's a very good screening for some of the major risk factors, stroke and heart attack. We also use it in our neuropathy patients or anybody that we're trying to increase vascularity to. What happened recently is really the development of better screening tools for this, and then ultimately better treatment products that can significantly reduce the risk. So we're going to get a readout in just a second, but what is happening is over a 3-minute period that the heart is sending a rhythm and a waveform down to the measurement site. Each heartbeat is being recorded, and then we get a published outcome. We'll go ahead and we'll take that pulse wave off. And what it's looking at is it's looking at resistance. As the artery becomes more sclerotic or hardened, or there's any kind of buildup, the resistance down that is going to decrease. So when we're looking, first we'll look at the wave type here. We'd like to see everyone have type 1. A type 1 wave type, it means there's really no resistance in that heartbeat. So Brittany, as we went through, had 93% of the beats that came out as a type 1, which is really excellent. As we get in type 2s and type 3s, we're seeing that the resistance goes significantly higher. We get a lot of other readings up in here. We get arterial elasticity readings, we get remaining blood volume readings. We get just a good screening tool where we know the vascular nature of what's going on there. So Brittany, in your case, this arterial elasticity, you're normal, you're even optimal. You're doing well in all these categories. Remaining blood volume, you're slightly low. But again, everything looks good. So let's say we have a problem that we see in this case. Well, if we need to send it to the cardiologist, we will. If we know we can change this. In 1998, the Nobel Prize in Medicine was given to the discovery of nitric oxide, not nitrous oxide. Nitrous oxide is used by the dentist. Nitric oxide is a gas in the blood vessel that's responsible for vasodilation. It makes the blood vessel healthy, helps keep some of the arterial elasticity at high levels. As we age, we often see this decrease. And so what the cardiology group, and that's the name of this group of cardiologists, as they took this information, they found if we can keep the nitric oxide high in the blood vessel, we can actually change the resistance of the artery. They developed what's called ProArgi. ProArgi is taking L-arginine and L-citrulline in about a 5-gram dose and dosing that throughout the day to keep the nitric oxide high. When we see resistance, almost always, if we do this over a 30, 60, or sometimes 90-day period, we can measure the changes in a functional way. We can measure the resistance there and almost always reduce that change or reduce the stroke and heart attack risk. So I grabbed this because I think this is a very easy, L-arginine, none of these, that product is certainly not risky, doesn't carry any of the risks of medications, and actually is changing the arterial resistance. In cases of neuropathy, and we're going to do a lot more videos for you guys on neuropathy and what's happening, but getting arterial or getting vascular increase down to the damaged nerve can also be very helpful. So Brittany, no need to worry. You don't need to be on this. If you're a patient of ours and you're watching this video, we're happy to do this screen for you, really at no cost. If you're looking just to get this screen, talk to us. We're happy to kind of let you know kind of where you sit and what can be done. Thanks.